Abdominal pain in pregnancy can be very concerning. In this video, I'll talk about some possible causes and, as a bonus, how to better talk to your doctor. My name's Heather Marr, and I'm a pelvic floor physical therapist. And I'm passionate about walking with women throughout pregnancy, delivery, and postpartum, and helping them connect to the pelvic floor of their body so that they can love delivery, decreasing the fear and increasing the confidence. Be sure to subscribe if you're new here so you don't miss out on future episodes. Today I'm going to be talking about 5 possible causes of abdominal pain in pregnancy, and as a bonus, how to better talk to and explain these symptoms to your doctor. So be sure to stick around. So what's happening? In pregnancy, of course, the uterus is growing 500 times its size. It's pretty amazing if you're on this pregnancy journey or if you've been pregnant. The body does an amazing job. But as it starts to stretch, it might cause some discomfort. One possible cause could be round ligament pain. The uterus there's a round ligament that goes from the uterus down to the labia majora or the mons pubis down here. So this area, as the uterus starts to stretch, especially at the end of the first trimester, beginning of the second, and sometimes through the whole pregnancy, these sharp pains, women say, I stand up or I cough or I roll over a bed and ouch, one side or the other can cause discomfort. Again, some signals that it's round ligament pain could be that, again, that's sharp pain and it's quick and then it goes away. Many women find that even just flexing or tucking a little bit or breathing or slowing down can help decrease some of the round ligament pain. Another pain that could cause abdominal discomfort is pubic symphysis dysfunction. Because of the laxity that occurs through pregnancy, sometimes this joint can separate just a little bit, causing some discomfort. Know that if this is discomfort on the bony area down here, you can go see a pelvic floor physical therapist. There's a lot of stabilization opportunities for exercises, as well as a Sorolla SI stabilization belt. There are options. You don't have to just put up with this abdominal pain in pregnancy. A third cause of the abdominal pain could be some discomfort in the bladder area due to urinary tract infection. This is why you always have a urine analysis when you go see your doctor. They're screening you for a UTI. What can happen is you can notice that you have some discomfort above the pubic symphysis area. Can be one of the signals. Some burning with urination and increased frequency of urination. If the urinary tract continues, sometimes it can go to a kidney infection, and kidney infection can move to low back pain, especially below the ribs on either side. So being aware of these symptoms, if you have a concern, reaching out to your doctor and letting them know that you have a concern about a UTI. Again, a simple urine analysis will be able to give you the results, and then your doctor can provide the treatment necessary. Braxton hicks could be a 4th cause of some abdominal pain. Again, Braxton hicks are like practice labor contractions. They're not true labor. They come in irregular intervals. They may tighten a part of your abdominal area. They may decrease with rest and decrease with hydration. You can go ahead and record these and connect with your doctor and let them know any concerns. And truly, Braxton hicks start even early in the end of the first trimester and second and third trimester. We just don't feel them all the time. So again, if you have this, it could be a Braxton hicks. And again, connecting with your doctor and letting them know what's going on. But that could be a possibility of abdominal pain. A 5th cause of abdominal pain could be an ectopic pregnancy or a miscarriage, especially if it's early on in your pregnancy. Again, if there's any concern about an intense abdominal pain and it's not decreasing, if you have bleeding or spotting, if you're having some change in fever, quick swelling, those types of things, again, those are times to reach out to your doctor and let them know what's going on. Pick up the phone, because it makes all the difference in the world just to have the peace of mind to know that nothing of concern is happening. Again, including your healthcare provider on this pregnancy journey as you have symptoms is really important. Ladies, it's always important to talk with your doctor or your midwife as you have symptoms throughout pregnancy. There could be many other different causes of the abdominal pain as well. As a bonus, I wanted to let you know, how do you more effectively communicate with your doctor? Because now you have a concern, but you want to express it very clearly. Use a tic-tac-toe grid, place it on your belly, imaginary. There's 9 quadrants. When you communicate, where is your pain? Is it on the right, the left, or the center column? And is it on the upper, middle, or lower? Your belly button is in the middle section. Round ligament pain would be on the right lower quadrant or the left lower quadrant. UTI pain may be more central and lower quadrant, as well as pubic symphysis pain. So it will be very helpful as you're talking with your doctor. Oh, it's in the upper left quadrant of my abdominal area. Again, effectively communicating so that you get the treatment that you need and so that your doctor understands what's going on, especially when you're talking by phone, can be very helpful. As a pelvic floor physical therapist, I love walking through pregnancies with women and helping them understand more about their bodies. Make sure that you connect and grab the book, Connecting with Your Body Throughout Pregnancy. It's available on Amazon, and it has so much information for you so that you can learn your parts, listen to your body, and love your delivery. Thanks so much for following, and make sure that you subscribe so you don't miss any future episodes.